Let me start by talking about the uniqueness of this partnership, which brings together many different groups, all aligning and working on this shared vision of trying to bring vaccines and new and powerful vaccines to the world's children. And you can see the expansion of vaccines that have occurred over this period, the protection we can bring for children. And of course, this is occurring in the lowest income countries where people are not able to afford these new vaccines, and our job is to subsidize them during this period until they're able. Of course, it also means that we're going to be bringing these vaccines and strengthening health systems in some of the most difficult and challenging circumstances in the world. And this is important to keep in mind as we talk about the success that we've shared together. Of course, there are a range of challenges we know about, and the Commissioner has implied this when he talked about things not being rosy. We don't have the best data in these countries. There are issues with coverage and equity. Certainly, as countries grow financially and take on the cost of their vaccines, making sure they can sustain that politically is absolutely critical. And modernizing the supply chain, making sure that the health system is ready to deliver vaccines is really critical for us to be focusing on in the next period. But there is so much that has already happened. This slide, which is rather complicated, shows where we were in 2000. On the top you can see measles, which had fairly high coverage. But if you look at a range of other vaccines, including vaccines against the two largest killers of children, diarrhea and pneumonia, you can see they were not being used at all in the poorest countries. By 2012, you can see launches have occurred. So we've had over 130 launches of vaccines, and now we're in the process of beginning to move those forward. And by the end of 2015, you can see the expansion that will occur in these vaccines. But the opportunity for the next period is really to bring this home and to make sure that each child is able to live up to their full potential. And so you can see here what it is we're talking about if we have a successful replenishment. Now, this is important because when we think about a child, it's not the statistic of each individual vaccine. It's how well is that child protected to move forward for its future life. And our goal here is to build a shield of protection that allows them to live into their full potential, to be able to succeed in school, to be able to make sure the family isn't tipped into poverty, and to make sure that they have their full IQ and able to be productive citizens, which make for productive countries. Today, less than 5% of children are fully protected by the 11 vaccines that the World Health Organization suggests every child on Earth should have. In this next period, we are going to be able to move that from 5 to over 50%. And of course, we are ambitious. We also keep to our promises, though. So this is what we think we can deliver. But of course, if we have the opportunity, we will try to do more. So when we look at Gavi as an organization, it has a period now, the next period, 16 to 20, is going to be the peak period of support. Now, why is that? We are going to be helping countries purchase 2.7 billion doses of vaccine in the next 5-year period. And as you can see, this will then drop off as countries themselves get wealthier and move into graduation. So this next period is a stretch, but it really is about trying to fill the needs of countries. And you've heard from the president here, but also in the previous video, the demand for vaccine that exists around the world. So in this previous period, we promised to immunize 243 million additional children and to have 3.9 future deaths averted, 3.9 million. In this next period, we're able to grow that, if we're fully funded, from 243 to 300 million, and to avert 5 to 6 million future deaths, which would be an increase of 41% in the overall number of deaths averted by bringing these fabulous vaccines to the children who need them. 300 million is a big number, What does that really mean? What does that look like? How do we conceptualize that? Well, as we think about the Earth, what it means in this next period is that more than half of the children immunized in the world will be receiving a Gavi vaccine. That is an extraordinary number. But let me bring it close to home, and let's talk about here in the European Union. So we will be immunizing more children every month than are born in the EU every year during this period. Or put it differently, in terms of the effects, the outputs, we're going to prevent more future deaths than there are children born in the EU every year. So I think this gives a sense of the magnitude and scope of what we can accomplish together if we all put ourselves together and work together. So our ask is for $7.5 billion additional over the next 5 years, and you've all gotten a prospectus that spells out details. This afternoon, we'll have a chance to delve in a little bit more to the details associated with this. But this will buy us an additional 300 million children being immunized with at least one Gavi vaccine. And of course, many times, this is not one vaccine, but it's 2, 3, 4 vaccines making a real difference. 5 to 6 million lives saved. An increase in fully immunized children from 5 to 50%. The economic benefits of this is between 80 and 100 billion US dollars. And just to put that in perspective, that is the equivalent to 2/3 of the OECD DAC donors' total development budgets for 1 year, for 2013. An additional $7.5 billion will also protect the past investments that have been made and pave the way towards sustainability. All countries last year were co-financing, and this is our expectation. Every country pays for their vaccines. When they're very poor, a little bit as they get wealthier, more until they graduate. So all countries co-financing. In the next period, moving into graduation, 22 countries having graduated from Gavi support. And of course, all the work that goes into working with those countries to make sure they can be successful as possible. Strengthened health systems. The immunization system is the base of the health system. It's what all else is built on. These are the interventions that have reached more children than any other intervention, and that's why it's critical to continue to reach those that are unreached and to expand our numbers. And finally, to transform the vaccine market even further. We've seen in this period that we've been able to drive prices down and create a secure supply, which is critical, but also bringing in manufacturers from around the world. We've seen our growth from 5 to 14 different manufacturers now from countries around the world, and this will create a more secure supply. So this is really what we're talking about as the investment opportunity in front of us. Thank you very much for your attention.